Joining me now via Skype from Uyo, he's a public health specialist, Dr. Nsiabasi Ekanem. Dr. Ekanem, it's good to have you join me now. And also join me from Lagos is Dr. Tolu Olufunlayo, the chairman, Association of Public Health Physicians of Nigeria, Lagos branch, and consultant public health physician. It's nice to have you join me too, Dr. Olufunlayo.
Good morning.
Good morning.
Good morning.
Good morning.
You for
All right.
having me.
Dr. Ekanem, let me start with you here. One would say that everything that can be done has been done. But as it is right now, we have not peaked, we have not plateaued, as it is said by the Nigeria Center for Disease Control and the health authorities. Talk to us basically, at this moment where states are considering reimposing restrictions, what more can anyone do at this point?
Okay. I think at this time we need to look at what we have achieved so far. We need to look at possibly where we have probably gone wrong. I still feel that we have not been as aggressive as we ought to be. The first lockdown was imposed. The question is, what did we achieve in the first lockdown? Now you want us to go into another round of lockdown. What do you hope to achieve? I feel that right now we have just carried out about less than 130,000 tests across Nigeria. For me, I feel that we have still not done enough. And I'm not seeing the public-private partnership here. In public health emergencies like this, it is absolutely necessary that we bring in other sectors. You go to a community pharmacy, you don't see patients go there and pick up medications. Some of these patients have already lost the sense of taste and smell. This is the case definition for COVID-19. But they don't have access to carry out testing there. Some of them patronize private laboratories across the country. They still don't have access to testing. I can remember the way we were aggressive about HIV testing. Government supplied testing kits to private laboratories to ensure that we are able to actively find cases. In COVID-19, the same does not go through. I believe that if we must change this narrative, because right now we are not big, we don't even know when we are going to be. I think there's need for us to bring the private sector fully. There's need for us to aggressively go out and look for cases of COVID-19. That's the only way that we can actually do it. And of course, we need to also communicate the disease risk to the ordinary Nigerian. I am not seeing the involvement of community-based organizations and NGOs effectively in this. If we must win this war, we need to send our message to the grassroots. The ordinary Nigerian must know that there is COVID-19. I will tell you for a fact, most Nigerians still believe that COVID-19 is a hoax. And that is counterintuitive to what we are trying to achieve. Okay. So we need to strengthen our disease risk communication to the grassroots. All right,
communication. We'll come back to that, talking about communication and awareness creation. We'll come back to that. Now, let me bring you on, Dr. Tolu Olufunlayo. Now, the point there is, at this point, what is the greater challenge here? We talk about ignorance on the side of the people on one hand, and then there are also complaints of a strategy or capacity of government and all the agencies. What is our greater challenge here if we have to compare the two?
Thank you. Well, I think they all pose a challenge because, as you might have heard and as you know, our health system has been very fragile. And my colleague has just outlined both issues from the side of government and other stakeholders and issues with the community. It's a whole responsibility for everyone to be involved. If you remember, the government has launched the Take Responsibility campaign, but that campaign can only fly if everyone is involved, if all hands are on deck. Now, we are beginning to see some elements of private participation, elements of community participation, but it's not a total package yet. It's just in bits and pieces. It's like we're still seeing pilots. For example, in Lagos State, we've just had the approval of the number of laboratories and a few private hospitals that will be involved in care and testing. But we need to get the grassroots driving this response, driving it by actually understanding what it is, perceiving the risk, and taking up the message. There's no, I mean, you don't have enough manpower to be able to enforce, compliance to all the measures that have been put in place across the country. We're a country of 200 million people with a very small police force, very small law enforcement. So even though there must be enforcement of some form, we must have the community driving this, community reporting, community sensitization, testing at local levels or referrals at local levels, like my colleague alluded to. In other countries in Africa, you can go to a community pharmacy and that's where you'll be picked up. Or the traditional birth attendants. We need to harness all these structures. The community development associations, the ward development committees, all these are areas where we can really strengthen them. But I must say that if we do all these things and we stick to what the national response is of test, treat, and isolate, we would be able to get a lot more done. It just needs a lot of strengthening.
All right. Now, Dr. Kanem, let me come to you on this. Dr. Olufalayo talked about the issue of enforcement. Dr. Kanem, I'm talking to you now. Now, when it comes to the issue of enforcement, what would you recommend what dimension should this take? Because there are some saying that the police and the soldiers and the security agencies should be rolled out into the streets to ensure compliance. But others are saying this is strictly a persuasive thing where people should just be talked to or spoken to and then they comply.
Well, like my colleague has rightly said, we don't have enough manpower to be able to enforce this. There's what we call community ownership. I think that's where our focus should be. We need to get the community to own this, to take responsibility, to see this as a collective, issue that we have to tackle, circumspectly. We need to appeal to the ordinary Nigerian. And I'll tell you this: if you talk about enforcement, a lot of Nigerians are with their face mask, but they only put it on when they are in front of a law enforcement agent. I've had to argue with a taxi driver who told me that he wouldn't put it on until we got to the police checkpoint. So would you call that enforcement? The truth is that we need Nigerians to understand the risk. Let them perceive it. Let them know that this thing is out there and it is deadly, and that we all need to work together to protect ourselves and our communities. I'll tell you this. You don't need a lot of policing if people actually understand what's going on. If you go to the market, ask an ordinary market woman, he will tell you that there's no need to put it on. So are you going to whisk our fingers, to put it on? No. I think we need to appeal to Nigerians. Let Nigerians, first of all, accept the fact that we have this virus, know how this virus occurs and how it's being transmitted and how it can be prevented. I believe that if we all understand it, if we all are on the same page, we will be able to take responsibility, whether in private, where nobody sees us, or in public, where we find the law enforcement agent, and together we can end this pandemic.
All right. Now, Dr. Olufalayo, the point there is, it is obvious from the numbers we have seen that a lot of people still have not gotten to know the details of what COVID-19 is, when you have these symptoms, this is what it means and all of that, especially those who are not within the metropolitan cities like Lagos or Port Harcourt or Abuja and Kano and all of that. But let us even narrow it down to places like Lagos, for instance, where when it comes to the information, it has gone out a great deal. But we still see people not complying. What should we attribute this to? This ignorance, is it just a habit issue, or the information is still not reaching out the way it's supposed to be? What do you think is responsible for this this gross inability to comply, even in the metropolitan cities?
Okay, well, it's really all about human behavior. Human behavior is a very complex thing, and it's rather difficult to change. When you want to change human behavior, internal motivation is very important. And that's why we are saying, just like my colleague has said, that ownership is important. So the way we communicate this information is very important. We must use different methods. So we're using social media and mass media. That's good. But we also need to use the community structures, because really those are the people that the communities trust the most. So we must engage them. We must let them understand what it's all about. We must let them ask the questions, dispel the rumors, explain how it works in a simple way. And then you'll find the community coming up with solutions that would be able to drive this response. This is really the only way that we can do it. Risk communication is key, and we are not getting enough of that done yet. What we're doing on TV this morning is very good, but someone listening in his home may say, oh, well, I know, but I don't trust the government, or I know, but how can something that I cannot see kill me? So we must get to them and engage them one-on-one, and that is what can be done at the community level. So I still think that this is very much lacking in the response, and must be increased if we want to, make changes.
Okay. Now, Dr. Ekanem, some people have talked about the issue of information overload. They've gotten so used to the issues around COVID-19, the mention of the word, the mention of the word COVID-19 or coronavirus, the issues of hand washing and social distancing. They are so used to it that it has no meaning anymore. How do we reconcile that with the issue of you know it and you're acting by it?
I think, like my colleague rightly said, it's about speaking their language. All right. Till today, you know that people are still very conscious about HIV. I still go back to that because people have come to realize, even though it has been said over and over again, but people have come to realize the damage that it can cause. I feel that there wouldn't be any need to actually complain that probably the information is too much if these people understand and appreciate the risk that this disease poses to their well-being. And having said that, I want to say that, like my colleague rightly said, I think it's time for us to go down to the grassroots. Let us understand how they think. A few weeks ago, I was involved in awareness with paramount rulers in Akwa Ibom State. The question they kept asking me was, what is actually the case definition for this disease? And I tell you that a lot of them had no idea about it. I feel that it has come up to a time where we need to utilize every means that we have, especially at the grassroots, to keep sounding this message. Let people know that this thing, fine, you can't see it, but it can actually kill you. And again, this leads me to one other thing. I think that is also a high time that people who have gone through this condition should come out and tell the world, tell the community that, look, I went through this, I know what it is, I have survived it. You don't need to get to where I've been. And these are the ways to preventing this disease. So I think there's need for us to make this thing look real. Because when it's real, people believe it. And when people believe it, they will not talk about overload. Rather, they will listen and practice.
All right. Thank you, Dr. Ekanem. Now, Dr. Olufulaya, let me come to you before I let you go. Now, the initial message around COVID-19 is that there's no need to panic. There's no need to fear. There shouldn't be anxiety because the fatality rate is below 3% and all of that. So people at first were scared, but when they got this continuous message of the fact that it is not as fatal as Ebola or some of the other diseases, people tend to relax a little because they said the greater percentage of those who contact COVID-19 will not die. Is that why we see this nonchalance from people now, because they feel that most likely, even if they contact COVID-19, they might survive? Is that where some of the challenges are?
Well, I think you're right in a way. COVID-19 poses a challenge because though being highly infectious, the case fatality or the number of people that will die after contracting the disease is very low. However, because it is highly infectious, if you allow everybody to get the infection, with a population of 200 million people, then you're looking for a tragedy. So we have been so far spared. You said that, I mean, before we started, we had a commentary saying that we crossed the 10 million milestone worldwide. You can see that in the United States, they have 1/4 of this burden. They have 2.5 million cases and rising. So we haven't had that proportion of cases yet. In Africa, we are looking at less than 500,000 cases overall. So the curve it's just beginning to gradually rise. So people haven't really yet seen the enormity of this COVID-19 pandemic. However, we don't want our health system to get overwhelmed so that we don't become like a country like Brazil or some of the other Latin American countries that are groaning seriously under the effect of COVID-19. So this is a challenge. People find it hard to relate to a disease that doesn't kill many people. But in actual fact, it can kill many in terms of numbers because of how infectious it is. So this is the reason for engagement. We must, try and understand what the challenge is with messaging and redesign the message such that people can still understand the risk.
Okay. All right, Dr. Tolu Olufalayo, thank you so much for joining us on the program this morning. And Dr. Nseabasi Ekanem, thank you also for coming on the program this morning. Really appreciate you.